Just as they all say that we have a story, I believe the same is true with regards to having a resolution or purpose, especially since our story often crafts our resolution. Each of you has or will eventually have something to work for. Moreover, something that keeps you determined in the hardest of times. For me, this was a person named Catherine Ahern, but more specifically, the tragic death of her. She was an incredibly generous, affectionate, compassionate, considerate, and wise woman. I met Catherine, or as I called her, Grandma Kay, when I was 6 years old, during her courageous battle with cancer, one of the most heinous and cruel ailments known to mankind. I went to her house almost every day to take her blood sugar and tried to inspire her with my hope that she would be okay. But as years passed and she grew weaker, there was nothing that could be done anymore. She withstood countless attempts of chemotherapy along the way, but no treatment had a long-lasting effect. Instead, she lost her hair, suffered from the horrible symptoms of nausea and fatigue, and lost her ability and even desire to withstand more. In July of 2011, we lost Grandma Kay to stage 4 cancer. 2 daughters and 2 sons were left behind without their mother for guidance. Grandchildren left without an amazing grandmother. 2 sisters were ridden with grief from the loss of their intelligent and loving sister. And me, I lost my best friend. All because of the horrible, nasty disease that we call cancer. A disease which current models predict will be contracted by 1 in every 2 people worldwide. A disease that accounts for more than 600,000 deaths each year and is expected to kill more than 1,500 people per day this year. 1,500 people. I want you to put that into context. The size of an average high school in Florida is just over 1,500 students, meaning that a whole school worth of people are dying every day as a result of cancer. One of these deaths could be a 3-year-old with leukemia or blood cancer. A 40-year-old with stage 4 renal cancer who just gave birth to their son. They could be your friend, sibling, parent, or grandparent. But what if all of this could be avoided? What if we came up with a therapy that cut these death rates in half? What if I told you that Grandma Kay did not need to die? That her children could still have their mother and I would have my friend? Grandma Kay is my purpose, drive, and something else. She's the reason that I put more than 30 hours a week into researching cancers. My hope is that one day, no child, no sibling, and no parent will ever have to feel the pain of losing their loved one to the unseen monster called cancer. And today, I am here to talk to you about how I plan to do that through my STEM research. How I plan to increase accessibility to a therapy that is known as the treatment which revolutionized the field of immune-oncology in the 20th century, so that more people, no matter their prognosis, have a chance to battle cancer and stay alive, to stay there for their children, to be there for their best friend. In order to understand the potential societal effects of my research and purpose, we must examine how it compares to previous therapies and understand the mechanisms of these cancer therapies. The groundbreaking therapy that I referred to earlier is something called immune checkpoint inhibitors, and this therapy works by inhibiting certain signals put out by cancer cells, which can check or limit the immune system. An example of one of these signals is PDL1, or programmed cell death ligand 1. PDL1 binds to a receptor protein on immune cells, called T cells, and the cancer, basically by expressing this signal, recruits these immune cells to the tumor environment as these other cells called T regulatory cells, and they actually fight off the body's own immune system and protect the cancer. And our immune system is responsible for fighting off disease. So if I could prevent the limits on this immune system by preventing PDL1 from being expressed, we could theoretically allow for cancer, or for the body to naturally fight off cancer. Previous approaches, aside from immunotherapy, include surgery and chemotherapy. Surgery, while sometimes effective in removing solid mass tumors, often leaves behind cancerous cells that can regrow into a tumor. Grandma Kay received a surgery where they removed her left kidney before I was even born, but this did not stop her cancer, which is why modern immunotherapies, such as one that blocks PDL1, are needed. Chemotherapies focus on using a chemical cocktail that is able to kill cells, but in the process, chemo also kills other human cells that it comes into contact with. And this leaves patients experiencing many other symptoms, including nausea, hair loss, as I mentioned earlier, and an overall lower quality of life. One of the benefits of immunotherapy is that it is targeted in ensuring that other organs and cells are not attacked. It's only the cancer cells. So we only attack what needs to be attacked. It's almost like quarantining the sick in a pandemic like this. However, there can still be serious side effects to these immunotherapies, which I'll address later. PD-L1 blockade therapy is a therapy which uses antibodies to prevent the interaction of PD-L1 to the T-cell receptor that I mentioned earlier, and thereby prevents T-cell deactivation. This has proven to be much more effective than previous options, with some studies noting as high as a 90% progression-free survival rate. And that basically just means that you still have the disease, but it doesn't accelerate. So if you're at a stage 1 or stage 2 cancer, you don't go to stage 3 or stage 4. Your cancer doesn't metastasize or spread to other organs. And to put this into perspective, previous traditional chemotherapies had progression-free survival rates as low as 3% and as high as 32%, which is only not even half of what the progression-free survival rate is for immunotherapies. Now that we have addressed the mechanisms and statistical effectiveness of these new treatments, I would like to address the concern behind this new therapy and my proposed research on how to solve this issue and how STEM is involved in it. So why is PD-L1 blockade not being used to cure all cancers? Why are many studies noting that only a sobering 15% of patients treated with this cancer actually mount a response, but those that do have 90% progression-free survival rate? There are two main reasons. First, one of them is called T-cell infiltration. This essentially means that the cancer's fighting mechanism through the PD-L1 blockade has been disabled, but also the body does not have any fighting mechanism to actually fight the cancer afterwards. So there are no activated T cells that can attack cancer cells once the cancer's fighting mechanism is actually disabled, which is an issue because then cells can't infiltrate the tumor environment and actually kill those tumor cells. The second main reason is that a lack of PD-L1 expression. Studies have shown that progression-free survival rates can be increased by more than 20% if more PD-L1 signals or proteins are expressed. By finding the mechanism to increase PD-L1 expression, this therapy could also work for many other cancers that were previously incompatible with it. In order for a cancer to be compatible with this therapy, it needs to express PD-L1. So if we could induce PD-L1 expression, we can make this therapy accessible for all cancer patients. And cancers such as those in the pancreas, which have a horrible prognosis due to the lack of existing effective therapies, would also be able to be cured by this, just by inducing that PD-L1 expression. But what if we could simply combine a few approaches to increase T-cell infiltration and PD-L1 expression in order to let all patients access this pioneering therapy? My research proposes combining two types of therapies to increase the accessibility of the benefits of PD-L1 therapy. First, by combining lysate therapy, and then using PD-L1 therapy as a follow-up. The lysate is just a mixture of broken down cells that allows you to isolate the antigens or markers on cells. These are like the identifiers. So if we introduce these to immune cells, then similar to a flu vaccine, this tactic would allow an immune response to occur that creates specific T cells and also antibodies that can identify your cancer cells and infiltrate the tumor microenvironment, therefore increasing tumor infiltration and likely increasing the effectiveness of PD-L1 therapies. In addition, by initiating these immune responses, there will also be increased expression of other signals. One of these signals is called cytokines, and these are released by the immune system to activate and signal other cells. Once cytokines, such as interferon gamma, are actually expressed, they can initiate a pathway that actually produces more PD-L1. And by activating these immune cells and increasing the production of these cytokines, we would increase PD-L1 expression and actually induce it in cells that previously did not express it, making it more effective. And theoretically, this would allow us to treat all types of cancers in a much more effective manner than we used to. So what effect could my STEM research have on society? For one, it will save numerous of lives, which is more valuable than anything else. From a social aspect, it will increase accessibility to this revolutionary therapy and decrease the amount of treatments that a patient would need to receive in order to go into full remission. The lysate aspect does not add a significant cost to the therapy as well, because it just involves harvesting your own cancer cells and then using a basic lab technique to break down those cells and isolate the antigens, as opposed to creating synthetic uh, T cells outside of a lab that would require you to actually synthesize new things, which makes this more cost effective. In addition, one dose of this immunotherapy would confer long-lasting immune responses, theoretically, where there are killer immune cells on hand to prevent cancers from going back, and the antibodies to stop the cancer from ever deactivating the immune system. Many chemotherapies involve at least four doses yearly, and even then, people do not go into full remission. But by creating these long-lasting immune cells, we allow for long-lasting remission. And chemotherapies are also, each dose is $12,000. So to have that 4 times a year, you'd be paying $48,000. And on top of the cost and terrible side effects, it is not long-lasting, like I mentioned earlier. So it's really not that useful compared to newer therapies. But we need to introduce new STEM research in order to make these newer therapies more accessible to everyone else. We can't allow this monster to win, and by using STEM, we can stop this disease. From contributing to social issues such as access to effective healthcare and therapies, STEM research is crucial to society. I want you to take a second to think of 4 people who are important to you. Based on current projections, 2 of them will contract cancer. This therapy could play an instrumental role in preventing their deaths as a result. It could stop many stage 4 and stage 3 cancer patients from being told that there is nothing to help them. It could stop people from going broke as a result of healthcare bills just because they were part of the unlucky 50%. It could prevent the socioeconomic depletion that results from these people going poor off of medical bills. It could have saved my dear friend who I miss every day. From the memory of Grandma Kay's suffering and the strength that she had while battling, as well as the unfaltering determination that I gained resulting from it, I know that I must and I will change these statistics. But with every goal comes a strategy. And in this case, the strategy is STEM research, and its importance in solving social issues must never be undermined. Thank you.